Yoga does give me a sense of calm and peace in my life. It helps remind me to be patient, to not get caught up in the crazy world around me. I was raised primarily by my father, who was a drug and alcohol addict. So that was always an issue present in our household. Our relationship and the troubles that my father was going through, that really kind of pushed me to go into healthcare and to, help people like him. The thing that really drew me to the Johns Hopkins School of Nursing was the opportunities that it offered students in the middle of Baltimore. I mean, it's a really diverse community, and I knew that coming here, I would get a really great education, as well as having all of these different areas that I could go into in the city to help out. The Accelerated Nursing Program is 13.5 months. And you start out with your basics like health assessment, and then you move into pharmacology, pathophysiology, and then eventually you have public health clinical. And that's going out and doing home visits with patients, keeping an eye on blood pressure, managing medications, assessing the entire environment that an individual lives in, and just to make sure that they get the care that they need. Nurses are so many different things, but one of the great things that they are nurturers and caregivers for the people that they serve. My father was in and out of rehabilitation several times while I was in high school, and also had a suicide attempt, so I kind of took on a role of caregiver. And then, as an undergrad, I needed to have a full-time job because I was supporting myself, and I was also sending money home to my father to help him out. Still, I was determined to go to nursing school no matter what. I was going to make it happen. But it was a little difficult to make this decision coming to Johns Hopkins because it is a rather expensive program. And the biggest part of my tuition and living expenses is actually covered by a private loan. But I did receive a 15% scholarship, which, of course I really appreciate. My long-term goal is to complete the family nurse practitioner program here at Johns Hopkins and practice primary care in the underserved rural communities in the South. I really hope to use the techniques that I've learned here to do the work that needs to be done. I look back and sometimes wish, I wish that would have been a little bit easier. I wish I would have not had to have gone through that certain thing. But I never really held it against my father because he was always very supportive of whatever I was doing. He probably told me every day just how proud he was of me. And now looking forward, it excites me to know that I can touch many different lives, helping communities become more healthy.